Hello, it's Michelle Morand here, and what you're about to see is a snippet of my interview with Dr. Razelle Kurzrock. Dr. Kurzrock is known as one of the 25 most influential people in the world in the field of precision medicine. She also has over 800 medical science publications to her name. She founded one of the most advanced clinical trial facilities at MD Anderson and now runs her own department of University California, San Diego in the field of precision cancer medicine and bioinformatics. The full interview link is in the discussion, but what you're about to see is specific to certain key elements of cancer treatment that I believe every patient needs to understand. And you're hearing it from one of the world's most respected individuals. So I hope you enjoy this little snippet of my interview. And if you'd like to talk with me further about how we can help you get access to some of the things we're talking about in this snippet, please just reach out. So let's go to really the reason for CureMatch, which is this information bottleneck, I call it, that we have now so many genes that can be tested for.
Right.
In RNA overexpression testing, you can look at 20,000 genes. Commonly used tumor-based DNA tests look at anywhere from 350 to 600 genes. And not all of those have targeted therapies yet. We have a long way to go with that, but the most common ones do, and many have numerous different targeted therapies. But we have oncologists who are like, they have large practices. They have about 15 minutes per patient as a rule. What would you like to say about oncologists' workload and the time they actually have to review data for each patient? What's your knowledge on that?
So I think that you've hit the nail on the head. Unfortunately, cancer is a very common problem, and I don't think the oncologists, there's any way that they can review all this genomic data. I mentioned this before, but I don't think any human being anymore can review all this data. So for instance, if there's 300 drugs available for cancer patients, if you look at 3 drug combinations, that's 4.5 million. And then you layer on top of that hundreds of thousands of different variants, and you're talking about billions, maybe more than billions of pieces of data. No human being can analyze that at this point.